Time now for this week's Health Matters, PA at large. Well, I guess, at large. You're all over the place, Lynn Szabo, these days. How you doing? How are things up on Last
Oh,
Chance
yeah.
Grade?
Well, I spent a lot of time there this afternoon after immunizing in Klamath, so it's pretty though, and what a beautiful day to be out there. But it did take about 2 hours,
Yeah,
so
yeah. Well,
yeah, go
so
north.
before we get into today's topic, how's the immunization scene? Dr. Raywalt here in Delaware County opened it up to everybody above the ages of 16 and 18, depending on which vaccine you get.
Right, we were going to talk about that. We can actually talk now if you want to, because
Oh,
it's so exciting.
I didn't read ahead on the notes. Were we going to talk about
No,
that?
it's that was my denouement, but we can talk about it now. So the exciting thing is on April 9th. And I think it's going to be in the late afternoon. So after normal working hours, they're United Indian Health and the Public Health Department are going to combine forces and have a mass vax event in Klamath. And what's cool about that is it's pretty much open to everybody over 18. Um, because there's going to be a little bit of Moderna. So if you want to get Moderna, have a good reason to get it. There's going to be about 20 doses of that available,
hmm
but there's going to be about 200 doses of J&J, so Johnson and Johnson, and I think that's over 16. So um, it would be a really great thing to go. And you might be saying, well, how can I get an appointment? So the best thing to do is to call the public health department number, and I have it right here. It's 707-951-6678. That's what it looks like. 79, sorry, 6679. So, or you can go online. There's an online way to do it too. Let me look at Ray Walt's email. So phone number again, 707-951-6679. The Del Norte County website is covid19.dnco.org /vaccines. And it says that the button for the schedule was right in the middle of the page.
Okay.
So yeah, so that would, if you wanted to get an immunization that day, that would be the way to do it.
And I guess
Um,
what's driving this is that just folks showing up for immunizations. The demand is down here in the county, and
yeah,
I'm
it
wondering if
is.
you have any insight into all the different communities in Delaware County that you truck between. Just do you have a sense of like what sort of percentage we're talking about so far, as far as people who've been vaccinated?
I think it's different, or that have been vaccinated.
Yes.
I'm only vaccinating for United Indian Health, so
Okay.
I have a
Okay.
sample size. But I will say, between we immunize at Elk Valley by the KFUG studio.
Mm-hmm.
We immunize at Howland Hall across the street from the casino in Smith River, and
Mm.
we immunize in Klamath at the Abalone Grill. And we have a lot of no-shows in Klamath, and I think it's because of the phone situation out there.
Mm-hmm.
They don't have a lot of broadband, and their phones just, they don't really, it's not like they work normally like they do in town. It's like you get a big dump of information and then nothing for a while.
Yeah, yeah, exactly.
So
Because they're right on the
yeah,
edge of the map out down there. So yeah, I guess it's going to
right,
be a challenge as we move forward and move through this summer and start kind of going around and backfilling the places that might have been difficult to reach or folks couldn't get into town to be immunized. I guess that's a concern for later on as hopefully we approach
right,
as many people as possible in Del Norte being vaccinated. But
right.
yeah,
It's interesting they chose to do it in Klamath, but I'm wondering if they think there are going to be maybe some Humboldt County people that'll come up.
interesting.
Uh, yeah, so there's letters in Wild Rivers. I think Jessica wrote it. Jessica Senior wrote the most recent article, so it would be easy enough for people to from who normally read Lost Coast Outpost, which is more widely read in Humboldt, to figure it out.
Mm-hmm. Mm-hmm.
But that would not be a barrier to care. So to getting vaccinated. And for the people who want J&J, who want the one shot, this is your moment to do that.
Why so?
So
Why now this moment?
because I think we just got some in.
Oh, okay. Okay.
Yeah. And so there's kind of been a mandate to use it for people who are homebound.
Mm-hmm.
So we're probably going to be sent out to people's homes eventually with it
Wow.
for people who are transient, and which I don't know why they don't send us behind Safeway. or there's a lot of places where there's a lot of homeless people. I think a pretty big group going out there might, you know, get some people to get immunized. That would be a
Yeah.
good thing.
Yeah, and the
And
Johnson and
then,
Johnson, that's a one shot. You're done. There you go.
right. And then also that's one of the ones that you can get when you're 16 and over. So there's
Okay, okay.
a
So
lot of teens that
that's
want
the
it.
second time you've said that, and we should clear this up because I remember it being different. I remember it being
Okay.
16 for the Pfizer and 18 for the Moderna and Johnson, at least according to the press release.
Okay. All right. Then yeah, let's get that right. So, although I thought it was 16,
Yeah, I
but
know. I know. I'm finding it. I can do this. Here we go.
when you're calling to schedule the appointment, ask them what's available and for what age. Then we can get it directly from the public health department.
16 and above for the Pfizer vaccine and 18 and above for Johnson and Johnson and Moderna.
Okay.
Yeah, there you go. That's
Okay.
from the press release from
Okay.
the public health officer. Yeah.
Okay. Let's correct that then. J&J is 18 and above. So, but anyway, it would be good for people that just want one shot.
Mm-hmm.
Weirdly, there's some people that kind of don't like what they see as side effects of the Moderna, and but Johnson Johnson's going to have them too.
Yeah, yeah.
It's a good immune response, so
Yeah,
it's kind of nice that people get it.
Side effects are not a bad thing when it comes to this. Exactly, exactly.
They are not. They are not.
All right, so
So
this week's topic proper, after our little prelude there, our forward, if you will,
yeah,
immunizations and COVID-19 in prison.
yeah, the California incarcerated population,
It
huge problem. We all know that from the media, though.
it has
Um,
not been a free and easy pandemic for the guys inside. They've been hit super hard, and especially in a couple of different locales.
Right. So half of the California inmates have become infected with COVID. So that's 49,000 people.
Wow, wow.
Yeah. And death tolls have been really high and outbreaks have been really large.
Mm-hmm.
Um, and then as of 3/16/21, 45% of incarcerated people have started the immunization. So fortunately, they have access to the immunization and a lot of them are taking advantage of it. So that's good. But in general, being incarcerated is a risk to your health anyway for a lot of different reasons, probably for mental health, but also for tuberculosis, influenza, hepatitis, and as well as COVID.
Mm-hmm. Mm-hmm.
And then, the inmates are aging, and when you go into a situation like that, oftentimes you bring a lot of comorbidities that you acquired kind of in your pathway to get into trouble like that. So there's a lot of HIV positive patients, a lot of hepatitis C positive, a lot of active Hep B, and tuberculosis being a huge problem there too.
And a larger population, proportionately of men and women of color as well, and there are specific health issues with that. I know one of my students, who's an older gentleman, his
Yeah.
whole family's got a history of sickle cell.
Oh, wow.
Mm-hmm. Mm-hmm.
Okay. Yeah, that's interesting. Yeah, I forget that. I did some study on that when I was on the East Coast when I was in training. But yeah, we forget that it's a thing here on the West Coast.
Right, right.
So we don't see it very often. So, and there's a lot of questions too. I mean, there's how the inmate stays safe. There's also people who are released in the community, how their families stay safe.
Mm-hmm.
Anyway, it's a complicated story. So how did it get this bad? So I think it's pretty known from the media that a busload of infected inmates traveled from Chino to San Quentin. So San Quentin was kind of like ground zero.
Right.
And because of poor oversight, lack of testing, lack of quarantine and isolation, lack of sanitation, basically they didn't get the care that they needed. I'm sure the prison's overcrowded too in San Quentin. I've seen that also stated. And the disease was off and running. But if you think about what prisons are like, now I have to say I've never been in Pelican Bay, okay? And I don't know a lot of their policies, but I have seen photographs. So it seems like it has kind of vulnerable architecture. Maybe you could speak to that. But it looks like, if you think of the tiers of cells with bars, so the ventilation is not great, especially for a disease like this. So tiny windows, so not a lot of air exchange from the outside, a lot of ventilation from the inside that has already been,
Yeah,
kind
recirculated.
of,
Yeah.
yeah, recirculated from other people's respiration. And then tiny cells, and 2 people in each cell, usually, I imagine.
Mm-hmm.
So, and then there's also been a problem too with inadequate testing. Oh, and going back to how the prison is structured, not a lot of outside time. So,
Yeah, and
yeah,
since the yeah, we could save it up. I've got updates from Pelican Bay specific. We can throw these in at the
okay,
end. But yeah.
okay. Well, San Quentin was reported to be the worst, with 70% of inmates infected. 28% of those people died. 400 correctional staff infected. One died there.
Okay,
So,
hold on, because you said 28% of those people died. It's not. It's 28 of those men died,
sorry,
right? Yeah,
yeah,
yeah. That's a.
28 of those
I was
men
going,
died.
whoa,
Sorry.
whoa. The mortality
I
rate just
know.
skyrocketed. Wow.
I know. I'm chasing people around all day.
Yeah,
Gave me the
it's
so sorry.
exactly.
Maybe I should have had a cup of tea before.
That's all right. You
Yeah,
give it to me all in writing. I'm following along. So if you don't mind me
that's good.
popping in every once in a
You're
while.
paying attention. So San Quentin reported to be the worst with 70%. 28 of those people died. So 400 correctional staff infected, one died.
Mm,
So what they did was kind of trying to balance inmate health with the needs for public safety. Now, this was not reported in the news, but it was reported kind of an overview of it was reported on NPR, but and more detailed information from Humboldt County is that they sent inmates. They wanted to decrease the population in Clinton. I'm just talking about Clinton now,
mm-hmm.
and so they sent busloads of inmates into each of the counties, and they put them up in motels for 2 weeks. The testing was not really done.
Mm-hmm.
The inmates were not really guarded.
Mm-hmm.
They were told to isolate for 2 weeks and assume they had it, but they were also given some money on debit cards, and they just all took off.
Wow.
So they kind of dispersed them into the community, at least in Humboldt County. And the NPR said that happened in every county in California. So I imagine it happened up here,
Man.
but it seemed to be not something anybody wanted to talk about.
And that was
So,
specifically from San Quentin?
yeah,
Mm-hmm. Mm-hmm.
yeah,
And
yeah.
I know that
So,
initially when they moved the initial bus load, I think it was like 128 inmates who came from, if I remember correctly, from Chino to San Quentin. That was in an effort to sort of disperse prisoners within the system itself, so that there weren't too many. There wasn't like a few overpopulated institutions, because California population levels have been dropping for about 5 years now, and so I think they were trying to spread them throughout the system and sort of mitigate any hard hit specific institution or facility, and they just were too late. And so they ended up. Both Chino had I think over 100 deaths. I don't want to speak out of turn here, but there's a lot more suffering in the men's facility at Chino than at San Quentin initially, I believe.
yeah, can you imagine that, having to be kind of, having no control of your situation and being in a dangerous, knowing that there was a dangerous virus there.
Mm-hmm.
Now, sanitation is not great. I understand you have to buy soap from the commissary. So hand sanitizer, I was told, was non-existent by a mom that had an inmate son in San Quentin.
Mm-hmm.
And when somebody gets sick, like if your cellie gets sick, that's just kind of the way it goes. They didn't
Yeah.
have any room to separate people. So that must have felt pretty terrifying for those people. There's really nothing they could do. So
The term that one of my friends, one of my students in Pelican Bay used was "fish in a barrel." Yeah, exactly.
exactly.
Yeah.
So, and their recommendations, they're being told by the CDC that what you do to keep an institution of incarcerated people safe is you wash hands, social distance, immunize for the flu, be able to isolate and quarantine. I mean, they couldn't do any of that. Have a plan for staff absenteeism. So the problem is that, it's not like the guards can just not show up for work.
Mm-hmm.
And oftentimes if they're sick or if they're supposed to be quarantining, they might not really have a choice to go along with what the CDC recommends.
Yeah. Yeah.
But they also did not have great availability of testing, and including diagnostic testing as well as screening testing. So, just a quick screen, which they could do. Usually they do batch screening where they take like samples from 10 people. I'm just using 10 hypothetically. It could be 100, and they run it and they see, all those people. There was some positivity in there, or studying the sewage from the from stool, because that's actually an easy way to see what the asymptomatic population numbers are likely to be. But none of that really happened. So none of the resources they needed to be well or to stay well or to try and get things under control were really available to an incarcerated population, which is really kind of sad. So
Okay, well, let me know when you want to hear what I know from Pelican.
Okay. I just want to say that for anybody who has inmates in their family, especially if they're going to be released, that the CDC website has really helpful information for how families accept an inmate back into their lives, and what they can do to keep the inmates safe and also the family safe.
That's good. That's a good point. Yeah. And there have been people who've been released specifically because of the pandemic, because they're low enough risk and they say, okay, you can go. Yeah.
Right. And I imagine a family on the outside, although delighted to have that happen, must be also slightly terrified and wondering how they ensure the safety of the family on the outside.
So go ahead. Yeah. I'm sorry. You go.
I just wanted to, you mentioned you had a friend there and you mentioned he opted not to get immunized because he felt like his routine and his isolation kept him pretty safe. And I thought about that, and I kind of agree with what he said, with what I know, which is, again, I've never been in Pelican Bay and I don't understand necessarily what somebody's life is like in there. The only thing I don't like about that is he has no control, really. And what if he is taken from Pelican Bay and shipped down to another prison? It's not like they give him a big heads up, and it's not like they have much control over it.
Okay. All right. So that's
what can you tell me about that?
We'll start with that specific guy. And so they do give you okay. Oh wow, how to begin? So his rationale for not receiving for opting not to get the vaccination was that first off, he had a lot of history as a kid in foster care, being forced to take medications, and he's got just a sort of doesn't want to be a guinea pig for medications like that. And when he told me that, I'm like, okay, I can't argue against that at all. If that's what you went through and that's why you're avoiding it this time, I totally get that. So yeah. His other thing is that he just turned 32. He's not. He doesn't have any comorbidities. Doesn't have any sort of a pre-existing thing. So he's just figured like I don't. Given my attitudes about medication and state administered medication at that, I'm going to sit this one out. And so yeah. And his thing was that they lock us down. They keep us separate. So here's what my understanding is of what the scene has been like in Pelican Bay, and it's vastly different from what you've described. Only because what you're talking about is based on other facilities that are more folded into the general life of California than Pelican Bay is, and of course farther back in time, what happened at Chino, what happened at CIM, and what happened at San Quentin, and that was right at the outset, and just like Del Norte County, Pelican Bay kind of sat the first couple of surges out, even though there were some staff who were infected initially, and that was a big concern. And Dr. Raywalt was all over that, and so was the folks on the health board here, the other doctors like Duncan and Caldwell, and so they were all over. Hey, don't move people. Let's keep it locked down as much as possible, at least on a Del Norte County wide sort of basis. And they more or less did that. There were some transfers that came in. My understanding is that when anybody was moved between prisons involving Pelican Bay, and this is later in the summer, that everybody coming in got 2 weeks in their own places, like they were put in place. They were put in quarantine. Like there's a very healthy quarantine protocol at Pelican Bay.
Very smart. Okay.
If somebody in a housing unit comes up positive, that whole housing unit is locked down and quarantined. That person is moved to medical. So it's not, or they have a special like a facility, a place where they would put all of the prisoners or all of the ill prisoners when they had some. And
where they could isolate people. I mean, there's special rooms and stuff you need. I imagine they have that though. It's pretty common.
And So what happened was things when we had that surge before Christmas, like back around Thanksgiving, it went off inside Pelican Bay. And the highest I remember, I want to say it was Thanksgiving week or there, right around there. There were just over 100 ill prisoners listed on the CDCR's, their COVID dashboard on their website. And I check that every day, and I give the numbers every day when I'm on the air, because that's part of the COVID update, is checking to see what's going on in Pelican Bay.
Okay, so there was transparency with the community, it sounds like.
That's
great.
And what I know about the protocol and what happens inside Pelican Bay, I've gotten right from prisoners. This isn't through the PIO or anything else. This is just talking to people. The yard time is way down. Housing units only go to yard as units instead of it being a whole yard time with however many different buildings are on a yard, because it's numerous buildings, numerous houses in houses, I forget what they call them, but they're buildings, numerous cadres, if you will, or cohorts on a yard. And so they're just doing yard time one building at a time, so that you...
And you're talking about how many people about in one of those units?
That's a good question. I don't have that off the top of my head. I don't know. Okay. I would figure a couple of hundred probably, but it's the same couple of hundred that they live with and mingle with. Yeah, it kind of becomes a super bubble in a sense. And then, of course, they got masks. They kept the I'm not sure what the hand sanitizer scene was. There was, of course, concern because they're alcohol based, and they didn't want the prisoners to get their hands on alcohol or do anything silly with hand sanitizer. But I don't remember. There was some workaround involved with that. When somebody gets sick, or when there's a hint of somebody's of sickness in a housing unit, it seems like the prison kind of overcompensates on the side of being cautious and has lockdown. For the last 10 days or so, there have been, after that initial, that 100 or so ill inmates over Christmas, there have been 0 inmates listed inside Pelican Bay. That's been going on for about 10 days now. And
that's awesome.
For a couple of weeks before, it was just one guy. And so then that one guy got better, and now there's nobody listed. So Pelican Bay, it sounds like, has taken care of this and has got... Not, I guess the term would be a head start, sort of, but not really. It's the opposite of a head start. There was a delay.
I think they learned from San Quentin's mistakes, and they had a buffer of time.
Right, exactly. And then just today from the PIO, I had an email exchange, and I asked him, because I'd heard from, like the one student who had refused the vaccine. I was talking to another student, and he was like, "I'm totally vaccinated. When are you coming back in?" He was ready to go again to start the programming in the classes. And so according to the PIO, Lieutenant Kenny Price out of Pelican Bay, about 100% of the prison population has been offered the vaccine. About 85% of them accepted it. And he said that the vaccination had been offered to staff, but he didn't have or didn't want to share. I don't know which, but didn't have the number as far as the percentage of people who accepted the vaccine among staff. But that's what I know from Pelican Bay.
Okay, so we're with the one person that who declined the vaccine. Mm-hmm. Is he African American or Mexican American?
No, he's African American.
He's African American. I'm wondering if there's definitely history for people of color in this country to have been poorly treated by the medical profession.
Yes.
Yeah, Tuskegee always raises to the top with that one. Mm-hmm. But there's also I think what I've heard from some people is there's a concern that the vaccine, like there's a different vaccine, and if you're in a minority ethnic group, then somehow you're given an inferior one, or somehow you're given one that's a problem.
Oh, wow.
And so there's a little bit of distrust. Well, there's a huge distrust of the medical community. Mm-hmm. Other than his being forced medication when he was in foster care, I wonder if he has any of those concerns too.
What concern?
It's impossible to say.
He didn't voice any sort of like conspiracy theory like that. What his concern was that there wasn't enough known about the effects of the vaccine specifically on people of color.
Yeah, well, they were included in the studies, so.
He said the same thing about pregnant women as well, and I remember talking to you about that when we had that whole health matters about pregnancy and the vaccination.
Right.
and how there were some, but it wasn't a specific like natal like a pregnancy study. It was just if I remember correctly,
Right.
it was just kind of incidental stuff in other studies. So
Yeah.
yeah,
Well,
yeah,
they're collecting more data even since we spoke the last time
right.
about that, and it's looking safer and safer and safer for second and third trimester. So, um,
Yeah.
I was just curious about that because it would be nice if the medical community, number one, behaved themselves better at all times and in all places, and
Mm-hmm.
then, and it also if we could convey our message to people, a little bit better so that they could and maybe make decisions with what I think should be more clarity. But I
Mm-hmm.
understand people's life experiences bring them to certain places, and not everybody trusts medicine like I embrace it. So,
Yeah, yeah, right, exactly,
yeah,
exactly. And I have, no idea, if they got a brochure about the historical implications of the COVID vaccine or anything when they were offered it inside. But yeah, there are
right.
a lot of guys in there who will look askance at, taking an injection from the government.
Yeah. Oh, completely.
Yeah, right,
And
right.
yeah, yeah. Seeing that in the native population too, I went working and immunizing for United Indian Health. Certainly, the elders were really excited to get it, but a lot of people, especially younger people, were not going there. So,
Wow.
and it took a while. They kind of watched everybody else's responses,
Mm-hmm.
and some people kind of changed their mind and slowly became more, vaccine accepting.
Yeah.
But the hesitancy with people who have a bad history is completely understandable.
Yeah, yeah. It
Yeah,
really is. It really is. And
right.
I really want my friend Abdul. He's got the prison Muslim converted name, and he's just a terrific
Yeah.
guy. I really want him to get the vaccination, but Whitey isn't going to stand up and say, "Here, put this in your
I
arm."
know.
I'm not going to do that. I have nothing to do but like respect. Okay, yeah, I respect you. You do you, right?
Yeah. But I think checking in again every once in a while is not a bad idea.
Oh,
Not
oh.
not not in a nagging way.
Okay,
Not in
hold
a I
hold
you
on.
know.
I've got some breaking news here. We're gonna break in. This was just
Yeah.
posted from Jessica. Watching this was an article. She sent it on Facebook to KFUG. Jessica Sanar from the Wild Rivers Outpost. 34 new COVID-19 cases were reported to the Del Norte Public Health Branch on Tuesday.
Oh my God.
That's going to
Not,
double. That
not
doubles.
again.
Yeah.
Are you kidding?
Yeah, and it's gone.
Wow.
It went up. It was like 11, 12. Today was like 14, 34. Wow.
34.
That's see.
All right.
Okay. Well, there we go. I guess we can foreshadow next week's episode. That's going to drop us, I'm sure, in the tier. That's going to put
Yeah.
us back in the purple tier. That's going to close businesses
Yep.
down. This is going to be highly disruptive. Wow.
Yeah, I know we're getting a lot of positives. I guess we tested at United Indian Health about 19 people today. So a lot of people are symptomatic and coming in for testing.
Oh
So
wow.
that's drive that too. Oh man. Shoot.
Yeah. Yeah.
Okay.
Yeah,
All
let's see.
right.
So, what does he say? This is a quote from Ray Walt, Dr. Ray Walt. If we get a lot of cases like this that still hang together, especially for 2 weeks in a row, then we're going into purple. So, we're not going into purple right away right now, but jumping from yesterday's total, which was 14 new cases, to 34, that does not bode well for tomorrow.
No, that doesn't.
Hmm.
Maybe we should take a lesson from Pelican Bay
Yeah, right. God.
because they seem like they're doing it right. I
Oh.
will say too, I work at the county jail. I'm not there very often, but so far they seem like they're pretty stable. They are immunizing inmates.
Mm-hmm.
I don't know if they're immunizing guards. Guards don't like to talk about their personal stuff, and I respect that. But I have not seen any inmates, nor do I know of any inmates who um, were sent away with concerns about COVID.
Mm-hmm.
It's pretty easy to release somebody if they have a disease process that's threatening to other people in a county jail situation.
Yeah. Yeah.
Not 100%, but so they seem like they're doing okay right now. But they get new people in and out of there every day, and they're really protective too. The juveniles in the juvenile hall
Mm-hmm.
situation, which by the way is a beautiful facility, but.
Is it the
Um,
one back behind the fairgrounds?
Yeah,
Yeah, yeah,
it's
yeah. It's nice tucked away back there. It's kind of a sweet spot. Yeah.
it is. It is, and there are not very many kids back there ever, so that's good. They seem well attended, so I'm
Mm-hmm.
sure that's
Mm-hmm.
helpful. But anyway, wow, 34. I am blown away.
Yeah. Yeah.
Yeah. All right. So Mass Vax event, April 9th, in Klamath. Hopefully the road will be together enough that it won't be such a long wait, but probably worth it. I would not be surprised if they accepted people from the Southlands. So if you know somebody in Oric who's looking for immunizations, I don't think it would be too much of a hassle to drive up really quick.
I don't know anybody in Oric. Do you know anybody in Oric?
Of course I do.
Okay, good. Okay.
Yeah. So anyway, Oric's a misunderstood town.
No,
but anyway,
I love Oric. I'm a fan of Oric. Don't get me wrong. I just don't know anybody there. Since they closed the Palm Cafe, I don't know anybody there.
Oh my God, what's with that?
Where do they get pie now? Anyway, okay.
I know, and I like that they have a kind of little herd of elk that kind of hang out in the center of town, and they just kind of stand in the road and look at you like, "What do you mean this is your road?"
There is, if you get a chance, search it up sometime. A wonderful little 10 or 15 minute video on I don't know who did it. A video just on life in Oric, and it is wonderful. It is charming. Just kind of a history of Oric and talking to a lot of locals, and it's just. And from what I understand, like back in the day when the mills were all working, that place was lawless on Friday and Saturday nights. Paydays were just crazy in Oric back in the day.
I'm not surprised. You know that there was a big article, a cover story actually, in Nat Geo, looking at the demise of the town actually after
really in National Geographic.
Yeah.
Oh,
yeah.
I got to look that up. I got to find that. That's great.
So phone number of Mass Vax event is going to be in Klamath at 707-951-6679.
And that's the 9th?
So, yeah, it's the 9th. And It's going to be kind of later in the day. And I think they're trying to dodge the traffic problem at last chance. But I also think they're trying to get people who might be working.
Right. What are the hours?
Pardon me?
What are the hours?
They're kind of still setting them, but I think we're supposed to be in town at about 3:30, and I think they're going to start vaccinating like 4:30 or 5, and probably make it a 2-hour event.
Okay.
But they're bringing enough doses for 200 people, about 20 doses of Moderna, mostly J&J. So Johnson & Johnson, if you want the one stick, the one and done.
Okay.
That's your event. So 18 and older. Okay.
18 and older for the Moderna
and
J&J.
Yeah.
Okay. Well, Lynn, thank you, and I hope we don't have to start all over again with all of this, and start talking about, hey, wash your hands and wear your masks and get vaccinated and do all of that if there's another surge in the offing here in Delmar County.
Yeah, I would definitely double mask now.
Yeah,
I would advise that. CDC's advising it. I've been doing it. I'm the only one that I see that's doing it.
Okay.
But I think it's a good plan.
That's a good tip. Somebody, and I also saw something too. If you could take like if you're wearing your mask and you hold like a match in front of you and blow, and if you're able to blow out the match through your mask, that's bad. and if you can't blow out the mask through your mask, then that means it's stopping air getting through. It's
stopping air straight ahead of your mouth. It's not stopping stuff coming in maybe from your, around your nose or to the side. You know how some people, the side, there'll be little side pockets that are open.
Yeah. But I'm just, if you're wondering about the efficacy of the fabric, I think that's a good way to test it that way. As far as, tightness of fit, I can't help you with that.
I think it's a good start. And don't get upset if you can smell things through your mask, because the little scent molecules are way, way, way smaller than the virus.
Are they? I never knew that. Are esters smaller than viruses?
Yeah.
Wow.
That's what I read. Mm-hmm.
Oh, that's neat. That's a neat little fact. That's the kind of thing I'll remember. Okay.
But if you don't put the mask over your nose, I swear to God, the nurses are going to kill you. They get so mad when they see that.
You get an extra inoculation.
None of that. If you don't want the nurse mad at you, I can tell you that from experience.
Oh, no, it's true. That's true. Well, Lynn, anything else?
Nope. I'm not certain what to talk about next week, except I was thinking of doing a year in review and looking at what was in this pandemic, what was done, what I think is right, and what was done, what I think is wrong. But it could be a little political.
It seems kind of, honestly, it seems kind of soon for that too. If you're ready to sum up the pandemic?
No, I'm ready to hopefully move forward in a better way. But I don't know. I haven't really committed to it yet,
Yeah.
so
Okay.
stay tuned.
Okay.
We don't know. Okay?
All right.
All right.
Lynn
Talk to you next
Szabo,
week.
thank you so very much, and we'll catch you next week for whatever happens in next week Health Matters.
Yep.
All
Take
right.
care.
You too.
Bye.
Bye bye.